We'll go to questions without notice. Senator Gallagher.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. How many residents in aged care have passed away due to COVID-19, and when did the minister first become aware that 33 deaths of older Australians in residential aged care had not been reported until today? Why did it take until August for the Commonwealth to change its reporting obligations for deaths in aged care facilities?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. So the number of Australians who have passed away as of 8 a.m. this morning in residential aged care is 457, Mr President, unfortunately, and each one of those is an absolute tragedy, and my condolences go to every family of those who have passed away from COVID-19 to date. Mr President, for a period of time now, the Australian Government has been working with the Victorian Government through the Victorian Aged Care Response Centre to reconcile the data that is held in the Victorian systems with respect to infections and also deaths. As of the 12th of August this year, by agreement with the Victorian Government through the Victorian Aged Care Response Centre, we have been using the Victorian data and understanding that that data would need to be reconciled. I became aware of the difference in the numbers this morning when we were advised from Victoria that they would be announcing that reconciliation. I wasn't aware of what the difference in numbers might be specifically until this morning, and I received that advice through from the Secretary of my department this morning. My understanding, Mr President, is that the reconciliation process and the recording of COVID-19 deaths in aged care will continue. The Victorians are still working on that process as they manage the process through their FES system and their births, deaths and marriages records. We're working closely with them through VARC to continue that reconciliation process.
Senator Gallagher, a supplementary question.
Today, the Minister for Health announced additional funding to support the COVID-19 aged care crisis. Why has it taken the deaths of more than 457 Australians in aged care and 7 months of the COVID-19 crisis for the Morrison government to finally provide these resources?
Senator Colbeck.
Thank you, Mr President. Well, Mr President, the announcement that Minister Hunt and I made today was an extension of existing programs to provide continued support to the aged care sector through the COVID-19 outbreak. The first round was of the uplift for aged care providers was announced back in May. The retention bonus for workforce was announced in March. The program to apply for One Worker, One Site was announced in conjunction with the Victorian Government last month. And so the measures that we announced today were actually an extension, a continuation of our plan to help the aged care sector manage through the COVID-19 outbreak.
Senator Gallagher, a final supplementary question.
Thank you, Mr President. Minister, considering tracking deaths from COVID-19 should be a critical element of basic pandemic planning, how on earth is it possible that you did not know exactly how many older Australians in residential aged care had passed away from COVID-19 until today?
Senator Order. My apologies. Senator Colbeck.
Thank you, Mr President. As I explained in my answer to the primary question, by agreement with the Victorian Government, we have since the 11th of August been using the Victorian data to reconcile deaths in Victoria, Mr President. We had an understanding that there were some differences in the data, and Mr President, those differences have actually been publicly reported for a period of time. So the Australian Government and the Victorian Government understood that there would be required to be a reconciliation to understand that. we made a requirement that aged care providers report all of that information into the Victorian system, Mr. President, and so that work has continued cooperatively. There are some differences in the way that some of the deaths are classified, and we continue to work our way through that process, Mr. President, cooperatively with Victoria.
Order, Senator Colbeck. Senator McKenzie.
Thank you, Mr. President. My question is to the Minister representing the Prime Minister, Senator Cormann. Last Friday at the Daily Telegraph's Bush Summit, the Prime Minister acknowledged the heavy burden of restrictions on Australians, particularly in regional communities, who are limited in seeking access to essential and life-saving healthcare, education or work, and for farmers their own property to manage crops and care for livestock. As a strong critic of the one-size-fits-all approach taken by state and territory governments on border closures, I welcome the Prime Minister's call for relative risks to be assessed on the whole. Can the Minister please update the Senate on the steps the National Cabinet is taking to secure a national approach from state and territory governments on the definition of hotspots?
Minister representing the Prime Minister, Senator Cormann.
Thank you very much, Mr. President. I thank Senator McKenzie for that question. Mr. President, Australia is not built to have internal borders. That is why our government is focused on keeping Australia as open as possible while managing the health and economic challenges that COVID-19 presents. Border management must continue to be informed by the public health advice, which is why we are determined to get a hotspot definition based on that medical advice. National Cabinet has asked the Australian Health Protection Principal Committee to develop a common understanding of a hotspot across jurisdictions. The IHPPC will consider appropriate movement restrictions relating to a hotspot based on medical advice. This work is ongoing and will provide people who are living in those areas clear guidance on where and when they can access health services or where restrictions may mean they have to find alternative arrangements. States do not have to wait, of course, for National Cabinet to bring forward common sense, practical and compassionate solutions to their border issues.
On my left.
Senator As New
Pratt.
South Wales, as the Berejiklian governor in New South Wales has already shown by announcing a border bubble with Victoria, states can enact sensible exemptions, compassionate exemptions, common sense, practical exemptions right now by listening to and working with local communities in affected areas. The health challenge is significant, but we ask all state governments to continue to work constructively to resolve issues affecting the economic recovery. We need to ensure relevant exemptions are in place and applied consistently and efficiently, so that disruptions to critical services for border residents and all other Australians are minimised as much as possible. We are doing everything possible to help our border communities and the agricultural industry in particular get through this pandemic, and we call on all to join us in that effort.
Senator McKenzie, a supplementary question.
Thank you. The impacts on border residents being unable to access essential health care, jobs or schooling is continuing to detrimentally impact many residents and their families. Is the Minister aware of any risks to achieving a nationally clear, scientifically sound, fair and reasonable approach to defining hotspots?
Senator Cormann.
Thank you very much, Mr. President. We have seen widely reported examples of hardship for residents in rural and regional border communities. Such impacts should, of course, be minimised whenever possible. Decisions on border restrictions must be informed by public health advice. As I said last week, ultimately these are matters for the states and territories, but it is up to them to set out the medical advice, informing their decisions and to ensure there is a genuine public health upside in return for the restrictions and costs imposed on individual Australians and on our communities. There is no script or no rulebook on how best to deal with this pandemic, but it is critical that decisions are made on the basis of advice.
Sorry, Senator Cormann, I have Senator Bilyk on a point of order. On a point of order, Senator Bilyk.
Mr. President, I really sincerely cannot hear what the Minister is saying. Even though I might not want to hear it, I might not like it.
And
from that side.
Well, I can only order. Well, that's a charming episode of finger-pointing there across the chamber from both sides, I might say. Order. interjections. There's a lot of noise coming from the chamber. I was attempting to not interrupt the Speaker and call order. Please show your colleagues some courtesy. Senator Cormann.
The National Cabinet has asked the IHPPC to develop a consistent approach to hotspot management and to ensure that the needs of border residents are properly catered for. As the Prime Minister said on Friday, there will be a hotspot definition. Hopefully it's a definition agreed by the states and territories. Alternatively, there will be a Commonwealth definition based on science and evidence.
Senator Cormann. Senator McKenzie, a final supplementary question.
Thank you. I acknowledge the Nationals' calls for an agricultural workers' code as a priority and welcome the Prime Minister's announcement at the Bush Summit on progress being made to give effect to this very important initiative. Can the minister please outline the intended protections of an agricultural workers' code and update the Senate on the progress of this work?
Senator Cormann.
Thank you very much, Mr President. The Australian government recognises the challenges that communities and farmers have faced over the past few months as a result of COVID-19 and domestic movement restrictions. On 21 August, the National Cabinet agreed to the development of an agricultural workers' code to be considered at National Cabinet at its next meeting. The code recognises the importance of ensuring that farmers, seasonal workers, agricultural services such as vets and agricultural business can continue to operate in a COVID-19 safe manner. The Minister for Agriculture, Water and Environment is leading the development of the code, which would be enforced by states and territories through their public health orders. The fundamental objective of the code will be to provide consistency across jurisdictions in the application of movement restrictions, including any national hotspots definition developed, and indeed simple and practical definition of critical primary industries, and set out appropriate measures necessary to manage COVID-19 risks.
Order.
As always,
Senator
we focus
Cormann,
on protecting people's livelihoods.
Senator Keneally.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Today, the Minister for Health announced additional funding to stop the COVID-19 aged care crisis. Why has it taken the deaths of more than 457 Australians in aged care and 7 months of the COVID-19 crisis for the Morrison government to finally provide these additional resources?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. Thanks for the question, Senator Keneally. As I said in the previous question, Minister Hunt and I announced this morning $563 million to extend existing measures that were supporting the aged care sector. The suggestion that we've waited until now, quite frankly, doesn't make sense, given that these measures, Mr President, were put in place to support the sector. And what we did today was we actually extended existing measures to continue the support that we already had in place for an additional 6 months in most of those cases, Mr President. So early in the pandemic, we made some decisions, we resourced those decisions, and we announced the funding to support those. Today, what we did was to extend those provisions, given the fact that we remain in a COVID-19 pandemic. We have particular circumstances with respect to Victoria that require additional support, and the sector nationally remains under pressure. So what we did, Mr President, was we announced an extension to existing programs so that the support required for the sector throughout the pandemic, the support required as part of our plan, could be continued for a further period of time, so that the sector did have the support required and continues to have the support required as the pandemic continues.
Senator Keneally, a supplementary question.
Thank you. Given the minister admitted he only realised he hadn't got it right as a result of the outbreak at St Basil's in July, 6 months into the COVID-19 crisis, will he guarantee that the funding announced today by Minister Hunt will be enough to get it right?
Senator Colbeck.
Thank you, Mr President. Again, Senator Keneally chooses to misuse my words in a way that I didn't utter them, and it demonstrates the continued dishonesty of the Labor Party in asking questions in this place, Mr President. Mr President, the announcements that I made today with Minister Hunt are a continuation of existing programs, Mr President. They're a continuation of existing programs and existing support that was put in place to support the sector through the COVID-19 outbreak. And we will continue to provide resources, as I've said, Mr President, on a number of occasions through the duration of the pandemic outbreak. We will continue to provide additional support as required. We got to a stage, Mr President, where the existing supports were due to expire. We assessed that they needed to be continued, Mr President, so we made the decision to continue them, and Minister Hunt and I announced them today.
Senator Keneally, a final supplementary question.
In October last year, the government received the interim report of the Royal Commission into Aged Care, and it was titled Neglect. Why is the minister continuing to withhold the resources necessary to implement these recommendations from the report titled Neglect and prevent further neglect and avoidable deaths in the aged care system?
Senator Colbeck.
Thank you, Mr President. The government has not withheld support from the sector. The announcements that we made today, Mr President, were specifically related to assisting the sector manage their way through COVID-19. But, Mr President, on the suggestion of the Royal Commission and coming out of the report that was made by the Royal Commission in November last year, there were a number of additional resources supplied to the sector that the Royal Commission suggested. And that included an additional 10,000 home care packages. It included some resources to ensure that medication management and the use of chemical restraints were minimised. It included some funding to ensure that young people going into residential aged care were minimised. So, Mr President, we have continued to put additional resources to the aged care sector, and as the Prime Minister has said on a number of occasions, and as I've said, we will continue to do that at every opportunity.
Order. Senator Colbeck. Senator Van.
Thank you, Mr President. And my question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Can the Minister please outline how the Morrison government is extending and continuing its support for the aged care sector as part of our plan to assist the sector in responding to community transmission of COVID-19?
Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President, and thanks, Senator Van, for the question. Mr President, today the government announced a further $563 million in a package of measures to support senior Australians and aged care from COVID-19. These additional targeted measures mean that since the beginning of the COVID-19 pandemic, Mr President, the Australian government has provided over $1.5 billion to support senior Australians in aged care. This includes continuation of measures to support providers and support the choice of senior Australians. As part of this package, up to $245 million will be provided for a second payment of the lump sum COVID-19 support payment, Mr President, to residential aged care providers. Residential providers in metropolitan areas will get $975 per resident, and all other providers will receive $1,435. Mr President. This funding will be used by providers to fund and support enhanced infection control capability, including through an on-site clinical lead, quite importantly. Funding may also be used to address other COVID-19 related costs, such as increased staffing costs, communications with families and managing visitation arrangements. Mr President, this additional support will be provided to all mainstream residential aged care providers, also to Indigenous and multi-purpose services. The Aged Care Quality and Safety Commission will be undertaking risk assessments and audits to ensure that providers are prepared for an outbreak. This funding supports providers with this preparedness, Mr President. In addition to the risk assessments and audits, providers will report in their end-of-year financial year returns on how the support was used in overcoming additional COVID-19 related costs.
Senator Van, a supplementary question.
Can the Minister please outline how the government is continuing to support the aged care workforce at this time?
Senator Colbeck.
Thank you, Mr President. The package announced today further builds on specific measures that we've announced previously to support the aged care workforce at this time, Mr President. Continuing the aged care workforce retention payment program for eligible frontline direct care staff recognising the particular role that they play in looking after our most vulnerable Australians, Mr President. So we're extending the bonus for a further period to support direct care workforce and encourage retention at a cost of $154.5 million. In addition, we're supporting aged care providers and workers who may be affected by the single worker, single site principle, Mr President, in hotspot areas in regions in Victoria with up to $92.4 million in funding. Mr President, we're also extending this support from an initial 8 weeks to 12 weeks in recognition of the prolonged situation in Victoria and to allow providers to claim for a longer period.
Order, Senator Colbeck. Senator Van, a final supplementary question.
Thank you, Mr President. Can the minister outline the government's further ongoing support for senior Australians in residential aged care who are homeless, seniors at risk of homelessness and also Indigenous Australians in aged care?
Senator Colbeck.
Thank you, Mr President. Thanks, Senator Van, for the question. The additional $245 million, Mr President, of funding to the sector includes additional support that will be provided to all mainstream residential aged care, the National Aboriginal and Torres Strait Islander Flexible Aged Care Program, NATSIFLEX, Indigenous Program and multi-purpose services. This measure also extends the 30% increase in the viability supplement for both residential care and home care and the homeless supplement in residential care by a further 6 months at a cost of $26 million. The increase in the viability supplement will also assist home care providers and their consumers, Mr President. In addition, the Australian government has committed an additional $71.4 million to support older Australians who temporarily relocate from residential aged care facilities to the community to live with their families as a precaution against COVID-19.
Senator Siewert.
Mr President, my question is to the Minister for Families and Social Services, Senator Ruston. Minister, through you, President, next month, when there will be 1.8 million people on the job seeker payment and youth allowance, the government will cut the coronavirus supplement by $300 a fortnight. Last week, Treasury predicted the effective unemployment rate will hit 13% by the end of the year. How many people are expected to default on their mortgage and be in rental stress when, firstly, the supplement reduces by $300 a fortnight in September, and secondly, if the job seeker rate goes back to $40 a day in December?
The Minister for Families and Social Services, Senator Ruston.
Thank you very much, Mr President, and thank you, Senator Siewert, for your question. And can I also acknowledge that you announced your retirement at the end of this session, come the end of this parliament, and acknowledge the great work that you've done on behalf of the people you represent. In response to the principal part of your question in relation to changes that are being made to both the job seeker and job keeper payments, but particularly the job seeker payment at the end of September, Senator, you and as well as everybody else was in this chamber back in March when we made the decision to put in place the coronavirus supplement for a period of 6 months. It was very clear at the time we were voting for a temporary payment. In July, a decision was made by the government that we believe that the time for the removal of that temporary supplement was not at the end of September, and so we have sought, and through an instrument in this place, to extend the elevated level of support to those people who find themselves unemployed past the end of September until December. At the same time, we've also put in place an increased income-free area, because we recognise, Senator Siewert, that the jobs market is still very shallow, but it is starting to open up. And we want to encourage people who find themselves unemployed as a result of coronavirus to actually take the steps to start re-engaging with the workforce so that we can hopefully get them re-employed as quickly as possible. And the one thing that we do know—
Senator Siewert, on a point of order.
I understand I did a bit of preamble, but we're now down to 30 seconds left in the time to answer the question. The minister's come nowhere near my question, which was how many will be defaulting or in rental stress when the supplement is cut.
Okay, Senator Siewert, I'll say again, when questions contain a preamble, the minister can be directly relevant to part of a question. That was the second part of your question. The minister is being directly relevant to other parts of your question, in my view. Senator Siewert, A minister can be directly relevant to assertions and a preamble to a point made at the end of a longer question. That is within standing orders. So I can't direct the minister how to answer a question nor which part of it to answer. Senator Ruston.
Thank you very much, Mr President. And as I said, Senator Siewert, past the end of September, we are intending to continue to provide elevated levels of support to people who find themselves unemployed, whether they were unemployed before the coronavirus hit or as a result of the COVID pandemic. Because we on this side of the chamber understand we have a responsibility to balance providing the level of elevated support people need, as well as making sure that we provide the incentive for them to re-engage with the workforce, because the best thing we can
Senator
do
Ruston,
is get
time
them
for
back
the
into
answers
work.
expired. Senator Siewert, a supplementary question.
Thank you. I'd just like to say thank the minister for her comments about me retiring at the end of my term. I'd just like to reassure the chamber that I'll be here for quite a while to give you hold you to account. The latest research from ANU shows that the coronavirus supplement almost eliminated poverty amongst job seeker recipients, and the reduction of the job seeker payment will mean that 740,000 people are pushed into poverty. Minister, how is this conscionable?
Senator Ruston.
Thank you very much, Mr President, and I have no doubt that you will continue to hold us to account in the time that you have left here, Senator Siewert. In relation to your question around the elevated levels of support that were put in place back in March by this government, it was clear at the time that we recognised that we had before us an absolutely unprecedented situation, and we put in place these supports to help Australians to get from one side of the coronavirus pandemic to the other. Clearly, as the pandemic has rolled out, we have seen different things happen in different states. But the one thing that we have started to see in the majority of Australia, our economy is starting to open up again, and we're starting to see jobs created. It is the responsibility of government, as I said before, to manage the balance between providing elevated levels of support in recognition that people are still doing it quite tough as a result of the coronavirus pandemic, but at the same time we need to make sure that people understand they need to re-engage with the workforce, because getting a job is the best way out.
Senator Siewert, a final supplementary
Thank
question.
you. Through you, Mr President. Minister, at the COVID hearing not long ago, you said that to make any changes to the ongoing structural nature of our welfare system when we're in such a state of uncertainty would be completely irresponsible. How is it irresponsible to guarantee that you won't drop people back into poverty on $40 a day?
Senator Ruston.
Thank you very much, Mr President. And I think that everybody in this chamber recognises that we are in quite unprecedented times, and we are still in them. There is absolutely no doubt that the end of this coronavirus pandemic, when it's going to end and what it's going to look like when it ends, still remains something that we are unsure of. So therefore, the government has remained flexible, and to make sure that the temporary nature of the provisions that we put in place recognise the constantly changing conditions that this pandemic is presenting to the Australian economy. You only have to look in Victoria to realise that we have a particular set of circumstances down there, and we've seen the announcements today in aged care to directly deal with those particular instances. But what we have to do as a government is that we have to manage our way through this pandemic, putting in place the provisions that are required at the time, and when we get to a situation where we understand what the new normal looks like, that is the time to make structural change.
Senator Farrell.
Mr President. My question is to the Minister for Youth and Sport, Senator Colbeck. On the 27th of February, Sport Australia told the Select Committee on the Administration of Sports Grants it would provide the legal advice underpinning former Minister Mackenzie's authority to make decisions in the Community Sports Infrastructure Grants program. But last week, the Sports Australia informed the Select Committee it would not provide the advice, as the Minister for Sport had made a claim of public interest immunity. When did the Minister make that decision, and on what basis does he make the claim of public interest immunity?
Minister for Youth and Sport, Senator Colbeck.
Thank you, Mr President. The decision to make a public interest immunity exemption was made some time ago, Mr President, and Mr President, on behalf of the government, I claimed public interest immunity in relation to Sport Australia's legal advice, as the release of this advice could prejudice pending legal proceedings, Mr. President. Additionally, it's been the long-standing practice of Australian governments over many decades on both sides of politics, Mr. President, to not to disclose the fact or content of privileged legal advice. This practice has previously been outlined by many colleagues in the chamber, including the Honourable Gareth Evans QC, who said, nor is it the practice, or has it been the practice over many years for any government to make available legal advice from its legal advisers made in the course of normal decision-making process of government, for good practical reasons associated with good government and also as a matter of fundamental principle, Mr. President. So, Mr. President, in my view, my claim of public interest immunity was based on good and sound grounds, long-standing a practice on governments from both persuasions of politics, and, Mr. President, the government maintains that it's not in the public interest to depart from this established position.
Order.
It's integral that privileged legal
Senator
advice
O'Neill.
provided to the Commonwealth remains confidential.
Order. Senator Farrell, a supplementary question.
Yes, I do have one. Thank you, Mr. President. In March, the minister admitted he'd been coached by Mr. Morrison's staff before appearing to give evidence on the sports rorts scandal. Has the minister or his office discussed the public interest immunity claim with Mr. Morrison or his office, and if so, why?
Senator Colbeck.
Thank you, Mr. President. Firstly, can I reject the assertion about any activity or conversation between my office, me and the Prime Minister's office, Mr. President. So I reject the assertion of being coached. And again, Mr. President, Labor continue to make things up, Mr. President, and just because Labor says it doesn't make it so, Mr. President. Yes, I had a meeting with the Prime Minister's office, but it wasn't about coaching, Mr. President. Mr. President, I made the decision to claim public immunity, Mr. President.
Order on my left. Senator Colbeck, please resume your seat. I can't hear you due to the interjections. Please continue.
Mr. President, I made the decision to claim public interest immunity based on well-founded grounds and historical context of decision-makers in this parliament over a considerable period of time.
Time for the answers expired. Senator Farrell, a final supplementary question.
Yes, I do have another question. Thank you, Mr. President. Why is the minister refusing to explain to Australians the basis upon which the government claims that former Minister Mackenzie had authority to make decisions under the sports rorts scheme? What is he hiding?
Senator Colbeck.
Mr. President, as I've said in the two former questions, I claimed public interest immunity over legal advice on long-standing grounds that have been applied by governments of both political persuasions over a considerable period of time, and I believe, Mr. President, that I had good grounds to do that, and I made the public interest immunity question decision appropriately.
We're going to Senator Roberts remotely. Senator Roberts.
Thank you, Mr. President. My question is to the Minister representing the Prime Minister, Senator Cormann. In 2016, 17, 19 and 20, I cross-examined CSIRO's climate research team on 4 presentations to me. That revealed CSIRO has never said carbon dioxide from human activity is a danger. CSIRO admitted today's temperatures are not unprecedented.
Order. Sorry. I've asked repeatedly last week for interjections to not occur, and they came from both sides of the chamber, and I might say they commenced on the opposition side. They should not have been responded to from the government side. Senator Roberts, I'm going to ask for stone silence in the chamber, and I'm going to ask Senator Roberts to repeat his question so that the minister may hear it and address it. Senator Roberts, can you please recommence your question?
From the start, Mr. President?
Yes, from the start.
Thank you. My question is to the Minister representing the Prime Minister, Senator Cormann. In 2016, 17, 19 and 20, I cross-examined CSIRO's climate research team on 4 presentations to me. That revealed CSIRO has never said carbon dioxide from human activity is a danger. CSIRO admitted today's temperatures are not unprecedented. CSIRO's cited papers do not show rate of temperature rise is unprecedented. CSIRO has never quantified any specific impact from human carbon dioxide. CSIRO relies on unvalidated, erroneous models. CSIRO relied on discredited papers. CSIRO showed little understanding of papers cited. CSIRO admits to no due diligence on reports and data. CSIRO allows politicians to misrepresent CSIRO without correction. 15 highly respected international scientists verified our conclusions. What is the basis for the government's climate and energy policies?
The Minister representing the Prime Minister, Senator Cormann.
Thank you very much, Mr. President. The basis of our commitment is, as part of the international community, doing our bit to help reduce global greenhouse gas emissions. That's the basis. We are committed to a sensible climate change policy which appropriately balances environmental protection with economic responsibility. That has always been our position. And as a country, we have not only met, but we have exceeded or are exceeding our emissions reduction targets agreed to in Kyoto, and we are on track and have a plan to meet our emissions reduction targets agreed to in Paris. I mean, we are a good global citizen. There is a global challenge that needs to be addressed, and we are doing our bit sensibly and responsibly and proportionately to contribute to meeting that challenge. In relation to the CSIRO specifically, CSIRO is a national treasure. It undertakes essential science and research which improves our lives and helps grow our economy. CSIRO stands behind its researchers and the integrity of the research produced by them. They have demonstrated their demonstrated record of scientific excellence is underpinned by their commitment to the full and transparent participation in the scientific peer review process, which results in evidence-based science of the highest quality, including making data publicly available. CSIRO is in the top 0.1% of the world for its 4 core fields of science and in the world's top 1% for the other 14 fields. They rank in the top 3 of the world's national science agencies for impact, and I note that the CSIRO has provided briefings to Senator Roberts in the past, and I also note that Senator Roberts has asked a number of questions which CSIRO has responded to and will of course continue to respond to moving forward. I hope that appropriately addresses Senator Roberts' question.
I thank senators for their courtesy during Senator Roberts' question, and I ask for it again. Senator Roberts, a supplementary question.
Thank you. Your ministers for climate and energy and preceding Liberal Nationals and Labor Greens governments claimed that climate and renewable energy policies are based on CSIRO advice. Yet CSIRO's climate team admitted to me that CSIRO has never stated carbon dioxide from human activity is a danger, and when asked for the source of that political claim, suggested I ask politicians and ministers. On what basis is your government claiming we need to cut the carbon dioxide from farming, industry, transport and driving cars?
Senator Cormann.
Thank you very much, Mr. President. There is a recognised global challenge which we believe needs to be appropriately addressed in a global fashion through an appropriately comprehensive global arrangement, and Australia, as a responsible international citizen, is committed to doing its bit, and that is precisely what our government is doing. Under our government, emissions are coming down, and electricity prices are also coming down. And we are keeping the lights on, bringing electricity prices down, and helping to reduce global greenhouse gas emissions in a way that is economically responsible. And we are very proud of our record, and we remain committed to that as the appropriate way forward.
Senator Roberts, a final supplementary question.
Thank you. The CSIRO climate research team's position ultimately relies on unvalidated and erroneous computer models that are not suitable as a basis for policy, in implying, falsely, that they have confidence in the models, yet have never assigned a quantitative calculated confidence level. CSIRO has misled you. Will your government hold an independent inquiry into the so-called science that is supposedly the basis of your climate and energy policies?
Senator Cormann.
Thank you very much, Mr. President. I think I've clearly stated the basis for the government's decision-making in relation to these areas. And I might just say again that as Australians we are rightly proud of the CSIRO. The CSIRO is a world-class organisation. Now, that doesn't mean that every bit of research is immediately right on the mark. But the CSIRO, like any scientific organisation, understands that any research has to be appropriately tested and peer-reviewed, and they are absolutely committed to the appropriate rigours and transparencies that apply to any scientific organisations of this nature, and that is, of course, appropriate. We completely support the important work the CSIRO does and continue to stand by it.
Senator Henderson.
Thank you very much, Mr President. My question is to the Minister representing the Minister for Health, Senator Cash. Can the Minister outline to the Senate how the Morrison government is investing in mental health support for Australians through the COVID-19 pandemic?
The Minister representing the Minister for Health, Senator Cash.
Thank you, Mr President, and I thank Senator Henderson for the very important question. And of course, during the course of the COVID-19 pandemic, mental health has been a challenge not just in Australia but around the world. The Morrison government recognises that the ongoing restrictions in place to stop the spread of COVID-19 are having a significant impact on the mental health of Australians, but in particular, as Senator Henderson well knows, in particular in communities in Victoria, who continue to be subject to severe lockdown measures. Mr President, since March of this year, the government has announced a number of emergency response measures to support the mental health and well-being of Australians through COVID-19. Access to telehealth services under the Medical Benefits Scheme has been expanded to include mental health, allied health professions and general practice. From the 16th of March to the 16th of August 2020, over 5.4 million medical benefit schedule subsidised mental health services were accessed, with 35.1% of mental health services delivered by telehealth. We're also investing in our frontline mental health services through our $74 million COVID-19 mental health support package, with $3 million for a dedicated mental health and wellbeing program for frontline workers, $10 million in funding to support older Australians through a community visitors scheme, $6.8 million for the expansion of Headspace digital work and study service, $10 million to establish the Coronavirus Wellbeing and Support Line, and $14 million to bolster the capacity of mental health providers such as Lifeline and Beyond Blue. We also have a $48 million National Mental Health and Wellbeing Pandemic Response Plan.
Senator Henderson, a supplementary question.
Thank you, Mr President. What additional assistance is the government providing to Victoria as second-stage lockdowns force Australians back into isolation, potentially cutting them off from family and social supports?
Senator Cash.
Well, thank you, Mr President. And as Senator Henderson has said, Victorians in some part, they're doing it really tough, and the government understands the severe nature of the COVID-19 restrictions in parts of Victoria, and we have therefore provided additional assistance to Victorians at this time. We're including the doubling of funding for the Better Access Plan to increase access to mental health practitioners through Medicare. For support for young people through youth support, there is $12 million for service surge capacity to Victorians, including $5 million for Headspace, with a particular focus on those in Year 11 and Year 12. Across all of Victoria, we are funding an additional 10 Medicare subsidised psychological therapy sessions for people who are affected by the further restrictions or who are in quarantine or required to self-isolate and have already used the 10 existing sessions that they have. We're also establishing 15 dedicated mental health clinics across Victoria, and our Senator McKenzie will please to know 6 are in rural and regional
has
areas.
expired. Senator Henderson, a final supplementary question.
Minister, what is the government's understanding of the impacts that additional lockdowns are having on Victorians, and where can people access support services if they need it?
Senator Cash.
Well, Mr President, the government is closely monitoring mental health service usage to respond quickly and lessen the mental health impacts of COVID-19 and the recovery phase. In the past 4 weeks, Victorian access to support services was 90% higher than the rest of the country. For Beyond Blue, 22% higher for Lifeline and 5% higher for the Kids Helpline. We're also, though, in light of this, in conjunction with the Victorian Government, we have agreed to establish a new Victorian mental health task force to ensure the latest initiatives are implemented as quickly as possible. And this is important additional assistance, of course, for Victorians at this time. In terms of the Beyond Blue Coronavirus Wellbeing Support Service, it's available to all Australians needing support through the COVID-19 pandemic and can be accessed via telephone or online. And through these services—
Senator Cash, time for the answer has expired. Senator McCarthy.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Today, Minister Hunt announced $92.4 million in funding to prevent aged care workers from working at multiple facilities. Will the minister guarantee that aged care workers will no longer work at multiple facilities? If not, why not?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. Today, Minister Hunt and I announced a number of measures to support the aged care sector to manage the COVID-19 outbreak. One of those measures, Mr President, was to support a negotiated agreement between the aged care sector and the unions in Victoria to ensure that one worker could work at one site, Mr President. Mr President, that agreement is not inclusive of the entire aged care sector. And of course, Mr President, there are some workers who we do require to work across more than one site. Mr President, so includes our ADF nurses who go into a number of facilities to provide assistance to the aged care sector when our facility is under stress. It also includes, Mr President, our AUSMAT teams that go in to provide assistance to aged care facilities when they're under stress. It also includes the Sonic and Aspen testing teams that are required to go in to do the testing for providers. Mr President, and it doesn't include, as a part of that program, agency nurses who are required for surge workforce capacity across the aged care sector in Victoria. So it supports workers who are employed normally by aged care providers to work in one facility, and the point of the program and the support that we're providing is to ensure that workers aren't worse off by the fact that they are asked to work across one site. So, Mr President, this is a continuation of that process, and the announcement that I made with Minister Hunt this morning extends the period of that program from 8 weeks to 12 weeks, acknowledging the ongoing circumstances of the pandemic in Victoria.
Senator McCarthy, a supplementary question.
Can the minister confirm that the A Matter of Care, Australia's aged care workforce strategy delivered to his government 2 years ago, recommended a national database of workers? Why has the Morrison government ducked the report and sat on it instead of taking action that would have better prepared its aged care system for the COVID pandemic?
Senator Colbeck.
Thank you, Mr President. In contrary to the question from Senator McCarthy, the government is actually actioning that particular proposal right now. The consultation process has completed, and we are working with the sector to provide a national workforce identification and registration process, and incorporating into that process qualification requirements that might be required for providers, that providers would need for their workforce across the sector. So, Mr President, it's not true to say that we're not actioning that recommendation. We in fact are.
Senator McCarthy, a final supplementary question.
Thank you, Mr President. Why has it taken more than 1,800 cases of COVID-19 in aged care, the deaths of 457 older Australians in aged care, and 7 months for the Morrison government to finally provide support for aged care workers?
Senator Colbeck.
Again, Mr President, I have to say that I can't agree with the premise of the question put by Senator McCarthy, because we've been providing support to workers in aged care since March, Mr President, since early in the aged care pandemic, Mr President. So maybe Labor are a bit concerned that they are so late to the party on this issue that they've only discovered aged care in recent weeks, Mr President. But we have been working with the aged care sector in this country since January to assist them and to prepare them for COVID-19, Mr President. So we've been working and providing advice and support to this sector on COVID-19 since January, and the measures that Minister Hunt and I announced today were in fact a continuation of existing measures that we'd put in place previously in recognition of the fact that the COVID-19 pandemic continues.
Senator McMahon.
Thank you, Mr. President. My question is to the Minister for Defence, Senator Reynolds. Can the minister advise the Senate of the defence outcomes from the recent AUSMIN meetings with her US counterpart?
The Minister for Defence, Senator Reynolds.
Thank you very much, Mr. President, and I thank Senator McMahon for the question and also for her unwavering support for the ADF right across the Northern Territory. So thank you. Mr. President, the United States and Australia are experiencing profound changes in our geostrategic circumstances. So now, more than ever, we must place a premium on ensuring our alliance continues to serve both our nation's interests. At AUSMIN this year, the Foreign Minister and I did just that. We delivered outcomes to ensure the alliance is best placed to respond to these challenges. At AUSMIN, Secretary Esper and I agreed to 3 new defence outcomes. These build on our substantial engagements over the past year. Firstly, we signed a Statement of Principles on Alliance Defence Cooperation and Force Posture Priorities in the Indo-Pacific. This builds on our force posture cooperation over the past decade, and it will drive the next decade of our cooperation. Secondly, Mr. President, we announced our intent to develop a US-funded, commercially operated strategic military fuel reserve in the Territory. This is a significant step in strengthening our supply chain resilience. Thirdly, we agreed to further deepen our defence science and technology cooperation. This includes hypersonics, electronic warfare and also in space-based capabilities. This will ensure the alliance maintains our capability edge. Colleagues, our alliance is in great shape, but we can never ever take it for granted. Both nations share a vision for a region that is secure and that is prosperous, one in which the sovereign interests of all states, large and small, are respected.
Senator McMahon, a supplementary question.
Thank you. Can the minister update the Senate on the initiatives to deepen defence cooperation in the Indo-Pacific?
Senator Reynolds.
Thank you very much, Mr. President, and again thank you, Senator McMahon. At AUSMIN, we agreed to deepen regional cooperation. Our forced posture cooperation is a tangible demonstration of our shared interests and our mutual deep engagement in our region. The Statement of Principles re-established a working group to develop recommendations to advance cooperation, both in Australia and also in our shared region. A modified marine rotational force in Darwin has proceeded this year, and it's gone very smoothly, despite the challenges of COVID-19. This is truly a testament to the adaptability and also to the strength of our alliance. We continue to strengthen our shared ability to contribute to regional stability. Our alliance remains a major force for stability and security in our region.
Senator McMahon, a final supplementary question.
Thank you, Mr. President. Can the minister outline the defence industry outcomes secured during AUSMIN and how this will support Australian workers and help drive the road to economic recovery?
Senator Reynolds.
Thank you very much, Mr. President, and thank you, Senator McMahon, for the question. And I particularly thank you for your support for defence industry in the Northern Territory.
Yeah.
Mr. President, a key priority was to secure new outcomes for Australian industry and also for Australian workers. Outcomes that build on the 15,000 Australian businesses and 70,000 Australian workers already benefiting from our investment in defence. At AUSMIN, we agreed to reduce barriers to industrial base integration, including Australian participation in US supply chains. And there is no better example of this than the 50 Australian companies that are already contributing to the global F-35 program. On this side of the chamber, we are committed to further developing our bilateral defence trade and to working together on export controls. Greater maintenance, repairs and overhaul of US platforms in Australia will mutually strengthen our capabilities and also
Reynolds.
our resilience.
Senator Wong.
Thank you, Mr. President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Tragically, more than 457 aged care residents have died from COVID-19, and there are now more than 951 active cases in residential.
Order.
We're talking about 951 active
Order. Senator Henderson, I'd like to hear
Would you
Senator
like to
Wong's
stand up
question.
and defend him?
Order. Senator Wong, please ignore the
I'd like to
interjection.
see that.
I've called Senator Henderson to order. Please
Tragically, I might start again if I may, Mr President.
as leader, I'll give you that.
Thank you.
Senator Wong.
Tragically, more than 457 aged care residents have died from COVID-19, and there are now more than 951 active cases in residential aged care. A 77-year-old St Basil's resident who did not contract COVID-19 died after suffering dehydration and malnutrition, which accelerated her dementia and led to her death. Doctors have described her situation as a case of neglect. How many Australians have died in aged care this year, not as a result of COVID-19, but as a result of neglect?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. It is quite tragic that Labor seek to try and play politics with the passing of senior Australians in residential aged care, Mr President. And Mr President, there are about 60,000 Australians who die in residential aged care on an annual basis, unfortunately, but that's one of the functions of residential aged care. I don't have statistics on Mr President, and the objective of the Australian aged care system is to provide all residents in residential aged care with a high quality of care across the nation. That is the focus and the purpose of our residential aged care system and the regulatory framework that supports it, Mr President. But as we know,
Senator Colbeck, up Senator Wong on a point of order. Senator Wong.
Thank you, Mr President. Direct relevance. I asked this minister how many Australians have died as a consequence of neglect, in the context, particularly, if I may say, of a report entitled Neglect handed down by his Royal Commission. If he's not able to answer the question, could he take it on notice?
I'm listening carefully to the minister's answer. In my view, if he is talking about people passing away in aged care, he doesn't have to adopt the terminology or the assumption of the question, but he does have to limit himself to that particular topic to be directly relevant. I think he is at the moment, but I will listen carefully. Senator Colbeck.
Thank you, Mr President. As I was saying, Mr President, we all acknowledge that there are things that need to be improved about the aged care sector in this country. That's why we're having a Royal Commission, Mr President. That's why one of the first acts of this Prime Minister Morrison, was to call a Royal Commission, Mr President. And I've heard Labor MPs trotting around this place over the last few days claiming that they supported it when they didn't, Mr President, including then Leader Mr
Senator
Short.
Colbeck on a point of order. Senator Wong on a point of order.
Point of order, direct relevance. How many Australians have died in aged care this year as a result of neglect? It is a reasonable question. I'd ask the minister to return to it.
Senator Cormann on the point of order.
Thank you very much, Mr President. I think that what Senator Colbeck was explaining is that it's not actually a black and white question the way Senator Wong is seeking to frame it, and he was making precisely that point. He was addressing very directly the fact he was addressing very directly that this is not a question that can be answered in the way that Senator Wong is seeking to do for political reasons.
On the point of order, on the point of order, I'm not Senator Wong. On the point of order.
On the point of order, dismissing a question that goes to facts as not being relevant because it's politics is really not consistent with the standing orders.
The motive of a particular question is not for me to make an observation on. There are times to debate it. Senator Wong, I would normally have pulled the minister up on the Royal Commission issue, but you did raise it in your previous point of order, so I was giving him some discretion to deal with that point that was raised. As I've said before, I think if the minister is confining his answer to the passing away of people in aged care, then he is being directly relevant, and I'm listening carefully, and he seems to be. So I'll call on the minister to continue. Senator Colbeck.
Thank you, Mr President. So across the country, as I said earlier, Mr President, there are about 60,000 people who pass away in residential aged care on an annual basis. The whole purpose of our system, Mr President, is to provide a system that is supportive, that provides a high quality of care, and this government clearly has an ambition to improve that quality of care. That's why we're undertaking the process that we're currently undertaking.
Senator Wong, a supplementary question.
Thank you, Mr President. The former Minister for Sport, Senator Mackenzie, resigned as a result of the Sports Rorts scandal. This minister has ignored the interim report of the Royal Commission entitled Neglect, the warnings from the Northern Hemisphere, the warnings from experts and unions, the warnings of Dorothy Henderson Lodge in March and Newmarch House in April, and more than 457 aged care residents have died from COVID-19. Minister, why haven't you resigned?
Senator Colbeck.
Thank you, Mr President. The government since January has worked closely with the aged care sector, firstly on preparedness, Mr President, and then we have resourced the sector in that preparedness, and we've continued to provide oversight of the sector to ensure that A, they are prepared, but also, if they're not, there's additional measures that are put in place, Mr President, and that's what this government will continue to do, Mr President. The Labor Party can play its political gotcha games all it likes, but what we will continue to do is exactly what we have done today, announcing additional resources and measures to support the sector as it works its way through the COVID-19 pandemic.
Senator Wong, a final supplementary question.
Thank you, Mr President. Under Prime Minister Howard, when one person died connected to the kerosene bath scandal, former Minister Bronwyn Bishop lost her job. Under this minister, aged care residents are so neglected, one had ants crawling from open wounds and residents are dying of neglect. Why doesn't this minister resign? Why doesn't he allow someone like former Shadow Minister for Mental Health and Ageing and Senior Senator from New South Wales, Fierravanti Wells, to replace him?
Senator Colbeck.
Thank you, Mr President. What I will continue to do and what the government will continue to do is to follow the medical advice, to provide the systems and the resources that are available to the aged care sector so that they can manage the COVID-19 pandemic and ensure that senior Australians get the care that they deserve. That's what we've done in Victoria by partnering with the Victorian government to establish the Victorian Aged Care Response Centre, and that's what we've done today by the announcements that I've made, along with the minister, to ensure that the sector has the resources that it needs.
Senator Cormann.
Thank you very much, Mr President. I ask that further questions be placed on the notice paper.